Kristen. My name is Marie. I'm going to be your nurse aide today. I'm going to be doing range of motion on you. Is that okay? Mm-hmm. Wash my hands. I would provide privacy. Provide for resident safety and raise the bed to the best level for body mechanics. So I'm going to raise the bed. I'm going to make sure that both the side brows are up. And I'm going to go ahead and raise this bed because I'm going to be standing on the other side of this bed and doing my exercises. Keep resident covered as much as possible with using the top sheet, bedspread, towel, or bath blanket. So we'll just use the top sheet. That's fine. All right, place in supine position in good body alignment. What does supine mean? How is she positioned? What is supine?
Isn't she in Fowler's?
She is in Fowler's, but
laying all the way back.
Well, supine means she is laying on her back. Okay. So this bed takes forever to put up. It's almost done. It's done. All right. And I make sure she's in good body alignment. So she's sitting here, she's all nice and straight. Okay. Before starting the exercise, each exercise or the exercise, make sure that you tell your patient, let me know if you have any pain during these exercises, okay? And I'll stop. We're going to start at the head and go to the toes. All right, so every joint from the head to the toe, we're going to exercise. So just think about joints, things that are movable, okay? And that's what we're going to be exercising. So starting with the head, there is 3 exercises for the head. We have head flexion, extension, hyperextension, right and left rotation, and right and left lateral flexion. So I'm going to hold her head like this, and I'm going to gently put her head forward and back, flexion, extension. 3 times. She's going to say no, no 3 times. And then I'm going to tilt her head to this side and tilt her head to this side 3 times. That was my wrist cramp. Okay, so I'm going to travel down. Now the shoulder. Shoulder has 4 different exercises. Okay, so we have flexion, extension. We do that 3 times. Make sure you're holding, because remember, if she does not have control of this arm at all, you're going to be relaxed. It's going to be like, okay? So you want to make sure that you are controlling and supporting each of the joints. Okay, flexion, extension. This is, remember, abduction. Abduction means what?
Away from.
Away from. So taken away from 3 times. We're going to have horizontal abduction, adduction, like this, so straight across the chest. And we have some residents over at the nursing home that really like this. Okay? And then I'm going to do the shoulder rotation. So make like she's going to wave, hello, hello, like that. Okay? So up and down like that. That's shoulder rotation. All right? Done with the shoulder, going to get down to the elbow. Well, your elbow can only go one way. All right? So that one will be an easy one to remember. So flexion, extension. Okay? Now we're going to go down to her forearm. Okay? This is forearm supination, pronation. So remember, prone means you're laying on your stomach. Well, I like to think of this as like your stomach sort of thing. So your hands down, pronation. Turn it this way, supination. So head up, head down. Pronation, supination. 3 times. Okay? Now we're going down to her wrist. And my goodness, you're like making big marks on you. Okay, so we have flexion, extension, hyperextension. So you just push the fingers back just a little bit more, okay? But you only do as much as she can handle, okay? Flexion, extension, hyperextension. And then you do, what's that called, internal deviation, yeah. Deviation of the wrist into internal and external deviation. Okay, and that's it for that one. All right, now I'm going to the next joints, which are fingers. Okay, and then now there's 4 of them here. So flexed the thumb and fingers by bending them forward into the palm. So I'm going to take her fingers and bend them into the palm like that, and bring them back out again. Stop fighting against me. 3 times. All right, the next one is abduct the thumb and fingers by spreading them apart. So you're not going to stand here like this with your patient because this arm's going to be weak. So you're going to be down here, but I'll just have it up here so you guys can see. So spread them apart, abduct, put them together, put them together. Okay, and opposition of the thumb to the different fingers. So you go like this. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. And then you do the thumb like this. Okay, do it both directions. And believe me, some people have like a very contracted hand. So they may not be able to do that. They may be only be able to do one finger. Okay. All right, so we're all done with that. Now we're going to go down to the nearest leg. So the next joint down is the hip. I'm going to uncover that leg only. Okay. So again, I'm going to go abduction, adduction, 3 times. Okay. I'm going to bend her knee up like this, and I'm going to bring her knee up as far as she can handle and back down. And that's exercising the hip as well. And just so you know, sometimes happens whenever you do that. Okay, and then I'm going to rotate. So put her foot back down here like this, and the only thing you have to do is back and forth just like that. Okay, and that's rotating hip.
My hip's about right.
Is it? All right, so that's the hip. Now the knee. Well, you know the knee only goes one way too. So this is extension, flexion extension of the knee. Okay. Now I'm done with that. Now I'm going to go down to her ankle. All right. So again, you're supporting, but really shouldn't have it up in the air like this. So I'm going to go internal rotation, external rotation, 3 times. I'm going to do flexion, extension. Actually, it's called something else. I think it's called pronation. No, wait. Foot. No, this is flexion. Okay. So flexion, extension. Okay. That's the only 2 moves for that. And now we're going to work our toes just like your fingers. Okay. So we're going to do abduction, adduction. We're going to go flexion. Oh, I cracked it. Extension. Oh, again. And I think that's all for the toes. Yeah. All right. I would repeat it on the other side. Same exact, except I wouldn't do her head again. I would go from her arm down to her toes. And now she's all finished. Are you okay? You tolerated that pretty well, right? Here's your call bell. I'm going to lower the bed for safety, back down to the bottom. Okay? And I'm going to make sure she's comfortable. I'm going to wash my hands, and I'm going to report if she had any discomfort during the exercises or if she had any problems at all. And that's it.
And this will be on the way back?